Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness. Hello and welcome to another episode of Birds, Bees, and Bodies, where we are going to dive into important topics affecting our communities and provide you with the information you need to make informed decisions. I'm Clara, hosting this episode today with Michelle Quesada, Vice President of Communications. And actually today, we're going to dive into a topic that affects many individuals and couples, infertility. This can be a challenging and emotional journey, but understanding the causes, treatments, and also support available can help those experiencing it toward the right solutions. We are very happy to have Dr. Therese Felix with us today. She's one of our physicians at Planned Parenthood, and she's going to help us learn more about this complex issue. So welcome, Therese, and if you mind, can you share a little bit of your background?
Yeah. Hi, everybody. Thanks for having me. First of all, I'm Dr. Therese Felix. I'm an OBGYN. We had in our residency program, we had a really robust infertility program. We had some very involved infertility doctors, so I had a fair amount of experience during residency training, and then afterwards in private practice, just with infertility services in my community. So I helped a lot of our members of our community get pregnant as sort of like a middle point between just a regular OBGYN and then an infertility specialist. So I love infertility. I love talking to my patients about infertility. I love helping with it. I love when people are able to overcome it, and love seeing the outcomes. So I'm happy to be here.
And infertility is a pretty new service for us still. We started it about like 10 months ago, I think, almost a year ago that we started infertility care. And Dr. Felix, I know this is something that is kind of tough for families to talk about, right? I mean, there's a lot of stigma surrounding infertility. Can you just share, what is infertility? When do you need to consider that you might be having some troubles conceiving and infertility might be the cause?
So the actual definition of infertility, when you have the diagnosis of infertility, is after 12 months of trying to have sex. Trying to conceive, just with having sex.
If you're trying to have sex for 12 months,
yeah, then that might be the reason why you're infertile, if you've had to try that long.
Oh, no.
So, or if you've had timed intercourse for 6 months and have not been able to conceive after timed intercourse, then you might want to consider getting some help from a physician for infertility.
Timed intercourse, you mean like you're timing your cycle, you're trying to have sex around ovulation, like, okay.
That's right. It gets a little bit more tricky for people that don't have regular cycles, but that you're still able to conceive. So sometimes people just need a little bit more help with trying to figure out when that ovulation event is happening. And sometimes you need help just forcing an ovulation event to happen. And so people that don't have regular periods, don't have regular cycles, there's still a lot of help and a lot of hope.
And we probably should have said this earlier, but we're with Planned Parenthood of Southeast and North Florida. So we have 8 health centers across the state of Florida that offer this care. And one of the things that people ask us about is, well, do you do IVF? Do you do IUI? No, our care is more basic. It's more about testing and finding the root cause to figure out what is happening, if there is anything happening at all, right? Because sometimes it's just a simple fix of a lifestyle change that might help you conceive. How is this beneficial, Dr. Felix, to people who are curious about their fertility status, like what we offer, or couples that are just starting to think about starting a family? Like, how does this treatment and testing that we offer help them?
Yeah, so a lot of times I get patients and they'll ask if they can get tested for infertility, and that's a really broad, vague question. So you really have to sort of narrow it down and try to figure out, first of all, what the concern is. So, like, have you been trying? How long have you been trying? What are your cycles like? Are you having regular cycles? So we try to kind of piece together a story based on your history. So it's, first of all, it's really helpful to come in with a decent history. You know, when do your periods start? How regular are they? How long have you been trying to have sex? Has your partner, um, have other children prior to your relationship with them? So there's a lot of questions that go into it. You know, sometimes I'll back up just a little bit. Infertility affects about 10 to 15% of couples. So if you're falling into that 10 to 15% and you have irregular periods, like, we're a really good first stop for you. We're going to try to help you figure out what your ovarian reserve is. Like, do you have enough ovarian reserve to even conceive on your own, or are you going to need some assistance with that? Are you going to need some medication to help you ovulate? We also offer at-home sperm testing kits at a reduced price. Currently, those kits are like $65. It's pretty affordable. You can come in and take some of these kits home, and you and your partner can test at home to make sure that there's enough motile sperm to actually get you pregnant. But I think as far as history goes, what I see most often in my private practice or in Planned Parenthood when people ask that is really, first of all, we have to educate our patients on what to expect and when things are happening. It doesn't really seem to make a lot of sense when you ovulate if you're having to count backwards, right? So when we try to figure out when your ovulation days is, it's 14 days prior to your last period. So it's really hard to try to figure that out on your own when ovulation is really happening. So the first thing I just try to do is try to get my patients to understand their cycle and when their ovulation window, when their fertile window is. So just with that understanding, you can start trying to put together a story and then add in testing if you need to. So like I said, we have some at home tests that we can send you home with. Sometimes we do testing in clinic. There are structural anomalies that sometimes can affect your fertility. There are sometimes genetic issues. Sometimes it's not, the female at all. There's male factor infertility that we have to look at as well. So it's a pretty broad subject. So when people say, "Can I get tested?" It's hard. Yes and no. Yes, you can, but we have to figure out where we're going to start. Usually starts with a really good history.
After we are saying, once the patients understand the process, what treatment options are available for those diagnosed with infertility, and how does Planned Parenthood support patients in exploring all these options?
So currently, and Michelle touched on this a little earlier, currently we're offering testing, but I'm hoping that we can expand the program a little bit more to offer more IUI services so that we can help our community a bit more. But for right now, for what we offer, just first of all, understanding where the issue might lie. If it's because of poor sperm quality, then that's really important to know, and to know early so that we can refer your partner out to somebody that can help them increase their sperm count or their sperm motility. If there's not a fix for that, then it's really important that you see a fertility specialist so that you can discuss more IUI options, or not IUI, but in vitro options, so that you can bypass that male factor infertility and then still conceive with your partner. So the earlier the diagnosis, and the more targeted the treatment, and the better the outcome. Unfortunately, for infertility or fertility, it's a ticking. The clock is ticking for a lot of us. So it's not just a matter of, do you have eggs and are you ovulating, but what is your egg quality like as well. And so sometimes you can, sometimes it's an age related thing, and sometimes it's not. Sometimes genetically speaking, there's a premature ovarian failure that happens and egg quality is poor. But how important is that to know early and early on? Because this is also an emotional time. Most of obstetrics and gynecology has a huge emotional component that's associated with it. So, there's a lot of times that when patients aren't able to conceive, they start feeling like they are less than. So less than, their potential. If it's a male fertility factor issue, sometimes those people feel less than, what they feel like they should be able to perform at a certain level. So that emotional toll, sometimes we can help keep that from getting so burdensome if we have an earlier diagnosis and can help you. We can help with referrals. We can help in some situations with ultrasounds or checking for fibroids, checking for polyps that are inside the uterus with saline infused sonahistograms. So we're starting to offer a lot more at Planned Parenthood. But time is of the essence, so we just start there.
And people might wonder, like, okay, if you're able to do the initial testing, just kind of see where I'm at and why I'm having this issue, if I present this history to you, if you don't offer these other services, if this is as far as it goes, then why wouldn't I go straight to a fertility clinic? Well, the cost of going to a fertility clinic, a private clinic, is very expensive, and you can ask any person who's tried to conceive that way in the US. Like, it's not cheap at all. It's an investment. Some insurances cover it, some don't, some cover partially. And you can run, it well into the thousands, tens of thousands of dollars trying to conceive. So, what we offer, is really just a first step to be able to understand if there's a problem or if there's an obvious problem. And help you, kind of guide you from there. Like Dr. Felix says, like, we can do referrals. There are some treatment options that we can do, right, with some hormones if needed, or things to ramp up ovulation and things like that. But really, it's just affordable. It's affordable to start with us, so at least you get your initial testing and get an idea of where you're at without spending $400 or $500 for a consultation at a private fertility clinic. And I'm just spitballing here. I don't know what it costs. Clara, you could probably share a little bit more, like what the cost looks like. Clara went out of the country for her treatment, so yeah. And a lot of women are doing that.
We actually, in our case, we started the treatment here, not the treatment, but the basic testing, right? The genetics and all those, tons of blood tests that obviously before you get the news, and in my case, I was told that my ovarian reserve was very, very, very low, almost zero actually. And when they told us that you guys have to start with an in vitro treatment, fertility treatment, as soon as possible, we spent like 4 to 5 months only by doing tests. And once we found out about the price in the US, which was to me ridiculous, because the first cycle, they already sell you the package for 2 cycles, meaning that when we heard that, it's like, okay, so they assume we're not going to get pregnant at the first try. So we flew to Europe. We went to Spain because I'm from Spain, and we found the best clinic, and the price was 8 times less than the price in the US, in the best clinic in the country. And I think it's very important you were mentioning the emotional factor or component, right? Because imagine after the first cycle, I have many friends, by the way, many people right now, many women around me are having in vitros one after another. And I guess it's a mix of lifestyle, stress, quality of life, right? All these factors that affect infertility. Also, that we get old and we decide to have children after 40 years old, which is not the best recommendation, I have to say.
40 is the new 30, right?
Yeah, well,
right? But it's true. Women are career driven. They have other goals, and they push starting a family to a little bit later in life than what we used to do in previous generations.
Yeah.
And people have to keep that in mind. Like, you think that you have a very healthy life, which is what I was having. Like, you eat well, you do things outdoors, you sleep 8 to 9 hours per night, and you exercise every day and you think, oh, I'm perfect, right? And all the blood tests are good and all that. And suddenly they tell you your ovarian reserve is super low and you have to look for new options. And you're like, how does that happen? In my case, it was a real surprise. And the problem is that infertility here is only for people who can afford it, because every cycle can be around $60,000, depending on what you need. This involves sometimes surgeries. I didn't know I needed a surgery in my uterus. I had no idea. Everything will look normal, right? So we have to keep in mind all these emotional components that I wanted to ask you about. Because what do you think, Dr. Felix, um, about this? Infertility can be an emotional and very stressful experience. It wasn't for me because I think that my personality, my motivation, for some reason, I knew I was going to be a mom. And I don't know, maybe this is crazy, but I knew I was going to be a mom at some point. I didn't know how. But how can Planned Parenthood help people face these challenges of infertility, and how can we help them assisting, right, and providing emotional support from our organization?
I think one of the biggest, most important, impactful things that happens is you find a provider that cares and hears you, so that you get some validation first of all, like, okay, I understand that this is really, really important for you. All right, it may not be important for everybody else, and especially at Planned Parenthood, where we're here for everybody. Sometimes the mix of crowds can be a little complicated, and sometimes it's not even at Planned Parenthood, but in private practices, when you've got somebody that's struggling with their fertility, but they're in a waiting room that's full of pregnant women. That's hurtful. So it's hard. It's hard for people in a way that I'm not in a position to quantify, because everybody is unique and everybody is different in how they process these things. But first of all, you have to have somebody that's going to say, okay, this is your story. This is your emotional burden. I've had patients that were really upset that it took them so many times to get pregnant when all the other women in their family got pregnant right away. So immediately they felt like they were less than their sister or less than their cousins or less than their mom, because they had more trouble conceiving or weren't able to conceive. So you have to have somebody that's going to take your story and understand that it means something really significant for you, where it may not be as important for the next person. And secondly, at Planned Parenthood, like the affiliate I work at, we're fortunate enough to have the behavioral health department. So again, if it's more than we can cover in an appointment, and it's more than you can manage on your own, you can stay within the Planned Parenthood umbrella and have that emotional support through our behavioral health program, just with telehealth. So you can keep it as private as you want to.
Absolutely. Yeah, we have a wonderful behavioral health department. And yeah, I think that's something that, anybody who's dealing with some, symptoms of infertility should voice to their provider, to their doctor, if it's weighing on them, and it's more than what just Glada mentioned. It's not just the, anxiety of wanting to get pregnant, of calculating your cycles and like obsessing over it. But then some women do get pregnant and then you experience early term losses. And and you're not, and it's unexplained. Like that happened to me with my first son. Before I conceived my son, I experienced 2 early miscarriages, and early as in the first one was very early. It was like I tested, when you're trying to get pregnant, you test like right when you're supposed to be in your period and you're so excited. And so I tested right on the day of my misperiod and I was pregnant. And then a week later, my period came and I was like, oh, so it might have been a chemical pregnancy. It wasn't a real pregnancy, or I had an early miscarriage. And then the second time around was more painful because we had gone to the doctor. We had already seen the pregnancy on ultrasound. We had verified that it was viable up to that point. And then, at eight weeks, I started to experience cramping and bleeding. And sure enough, went to the hospital and there was no longer cardiac activity. And so I was experiencing a miscarriage. And like that's emotional, even though it's really early. I think women at any point that experience a loss, like it's really a loss of a dream that you had for that specific baby, or wanting to start that family. and unexplained. Because after that, my husband and I said, okay, let's go to a doctor, let's go to a fertility clinic and find out what's going on. Did every test under the sun, just as Clara mentioned, and everything was fine on paper. There was no explanation for why we could not carry the pregnancy, other than the fact that I have thyroid issues, which is also another component. That's why it's so important to talk to your doctor and let them know about your medical history, everything that's going on. So to this day, we really don't know if that was the reason. Like the doctors couldn't tell us if it was because my thyroid was, fluctuating a bit at the time. But we moved ahead and we did IUI for my son. And for anyone who doesn't know, IUI is intrauterine insemination. So basically, it's just taking your partner's sperm and they put it up your vagina into your cervix, closer to the uterus, so that the sperm is able to make it to the egg much faster. And then they're able to also do a sperm wash where they separate all of the fragmented sperm, or damaged sperm, they like to say, and then leave only the healthy, strongest sperm to be able to make it through the vaginal canal. And so we conceived my son that way.
It's a little bit more than that with the IUI part, because they also have to wash away all the seminal fluid.
Yes.
So, and then straight into the uterus it goes, where the egg is, and we're just like,
yep. And then they do their job.
yeah.
Yeah, exactly. And it was great. We got pregnant on the first try, which, means we didn't have any other issues. This was great. And then, now I'm pregnant again with my second child, and that was conceived naturally. We didn't do any IUI or anything like that. It just happened. So it's hard to say sometimes, right? You hear about women who struggle for a long time and then, can't conceive and try a fertility clinic. And then all of a sudden, a year later, 2 years later, they just get pregnant on their own, and no rhyme or reason to it. Sometimes it's stress, I imagine, and other factors of life.
Right? Yeah. And just to be fair for the infertility clinics, because yes, it's super expensive when you go there, but when you think about the reputation of an infertility clinic, and when you're looking at the infertility clinic that you're going to choose the infertility clinic with the highest success rate. And so in order for them to standardize, or in order for them to maintain that high success rate, they have to standardize their patient care. So most of the time when you enter into fertility clinic, all of the testing and all of the imaging is pretty standardized, and it's almost like a buckshot like spray. Like, we're going to throw all of this testing at you to look for every cause before we move on to the next step, because my reputation is also on the line, right? I want you to conceive, but also I want you to conceive not just to make you happy, but also because the next person that comes behind you is going to want to know if I was successful with you. And so, when you come to Planned Parenthood, we're not doing all of that. We're doing part of that. We're starting small and starting simple. And that may have worked for you. It may not have. You're back at a situation where you don't need, an expensive fertility physician. And Clara, you had to leave the country for it because, oh my gosh, it's so expensive. And I had it done too. I had it done at 38. So Clara, I was old when I had my twins.
Still older.
Yes. But I sat there, I was single. I was in residency. I was an older resident. I knew that my fertility window was closing. And so I felt that pressure, and it happened that the group of residents I was with, as well as our attending, just sort of took me under their wing, and we all did it together. So it was kind of a neat thing, But I went through, the injections and all of the things that were, that just sort of take over your body, and all the highs and the lows of, did it work? But being on both sides of that has been really interesting. And I really love it. I struggled with whether or not I was going to go further and just be an infertility doctor, but they didn't deliver. So I decided to be OB/GYN. So
well, that's incredible. And you're right. There is so much attached to it, whether you're going through the IVF process, like it's a rigorous process on your body. It's hard on your body. Whether you're going through the emotional ups and downs of trying to get pregnant, like the whole thing is an emotional roller coaster. For many people. For other people, they just deal with the excitement of those 2 lines on the pregnancy test, and they got pregnant and didn't even know how, and it just happened.
Right.
And people too. I mean, like no one's at fault for the way that they are able to conceive. Like it just happens naturally. For many people, and for other people, it's a little bit more work. I did want to touch on the stigma real quick before we run out of time here, because I think that is something that burdens a lot of people from wanting to seek care. They'll think that their body has failed them. They're like, how is this possible? I went through that as well when I had the 2 early term miscarriages. Like, how can all these friends of mine get pregnant right away and don't suffer any complications? And I lead a healthy lifestyle. I do XYZ, and why am I the one having these problems? And you start to have that, those feelings of just resentment and guilt, about it. So I think it's important to mention that 1 in every 6 people will experience some type of infertility in their lifetime. So it is very, very common. It is becoming more common as Clara and Dr. Felix, both of you mentioned, like people are starting families a lot later in life. I think it's becoming more talked about now, right? Because I remember, when I was younger, my grandma would tell me about, my aunts and uncles, and my grandma would tell me I had an ectopic pregnancy, I had a miscarriage, and back then that wasn't talked about. No one knew about it.
Right.
No one knew about it.
Right.
So, as we get older, our elders are starting to open up and say, well, yeah, that happened to me too. Before your aunt and uncle, I had a miscarriage or I had an ectopic. And I think we need to talk about it more because it's normal. It happens.
Yeah, it does. And it's hard. I think our older generations, they don't tell us enough about their medical history and the troubles that they had. It was just a different time, and it was private. So they're not in the habit of sharing things, especially when it comes to reproductive health, especially when it comes to that. And so it's just expected, I think our parents just instill it in us as children that you're going to grow up and you're going to have kids. So the expectation is there that the expectation for my sons is that they go out, they find somebody and they bring me back some grandchildren. That just is what it is. And so, our parents did that to us. And so when we're not able to do that, when we want to do that, we start thinking, okay, and even just, I'm going to speak on this because I work for Planned Parenthood, but we've had patients that have had an abortion at some point, and then later on in life, when they're ready to conceive, they have trouble, and they will pull the guilt from that prior pregnancy into this pregnancy. Well, maybe if I hadn't have, had this abortion, then, and they'll pull religion into it. Maybe so it can be a lot of a larger emotional burden than is talked about until that exam room door closes. And again, you get with somebody that hears you and you're able to talk about the guilt that you've been carrying or the burden you've been carrying, or you're just able, to cry a little bit and have a hug and have somebody say, I'll help you get some answers. And just having that power of, yes, I have the knowledge that I make an egg every month, that I should be able to conceive. That is a huge, lift of a burden for a lot of patients, that they can then go to their partner. Maybe they haven't been comfortable talking to their partner and saying, now it's time for you to be tested because I have these answers about myself. I'm ovulating every month. And so now it's time we move to the next part, which is let's take a look at your sperm count and let's see what's going on there. And so it helps. It can be helpful to share that burden in a relationship rather than just having, the woman have to feel that.
Absolutely. And what you just said, Dr. Felix, I just want to make sure people know that an abortion alone is not an indicator on whether you are or aren't going to have kids in the future. That has no impact at all on your ability to conceive in the future. Right. The same thing with, and I feel it too, because I went through it, for women who experience miscarriages or people who experience miscarriages, a lot of the times you think about that and you're like, oh, well, my friend had an abortion and here I am trying to conceive. No two pregnancies, no two lives are the same, and no one should judge someone else for their decisions. Like, things happen. I know it's hard at that point to understand why you're the one experiencing a miscarriage when other individuals get pregnant and they don't want to be. And you sometimes think, like, why are they blessed with getting pregnant if I can't, and right. Everybody's different. Everyone expects something different. Everybody wants something different. And at different points in your life, right? Like maybe now you want to
That's
get pregnant, but maybe when you were, 19, 20, you would have been terrified and you wouldn't want a pregnancy.
Yeah,
So,
or you weren't with the right partner at that point.
right.
So things change, and I'm glad you brought that up, because I don't want there to be any sort of confusion. A lot of my abortion patients ask me all the time, like, please tell me this is not going to affect, my chance of getting pregnant in the future, and it's not. Whether you had, the procedural section D and C, whether you did the medication abortion, that doesn't have an impact on your future fertility, and so that's important to be said. It's important to internalize that. If you are having trouble conceiving and you did have an abortion prior, at some point prior in your lifetime, just so I can say it out loud, that's not what's keeping you from getting pregnant now. And so come in, ask some questions. Let's do some tests and see what's going on.
Yeah, I think it's important to remind everyone, now that you say this, that we can help them get more information about this infertility service that we offer at Planned Parenthood. Everyone can visit our website, www.ppsenfl.org, or they can just call us at 1-800-230 and the word plan. And then we can give them all this information we've been talking about for the last 35 minutes. And is there anything else you would like to add, Dr. Felix, or you, Michelle?
I would just add that, we try to, spread the word on our services and what we offer on our website, on our social media accounts. We're not just care, we're about connecting with you. So we'd love to hear from you. We'd love for you to see our posts, our informational, educational posts, and all the services we provide on our social media accounts at PPSENFL. Find us on Instagram, TikTok, Facebook, Threads. We're in all the platforms. And you're probably going to see a lot of videos of Dr. Felix on there too, because she loves to be able to work with us and support us in trying to get the word out. and love means we harass her to do these videos for us. No, I'm kidding. She's great. And it's so important for the community and for our patients to see the physician who's going to likely treat you if you're going to the health center they work at, and hear from them on, why the service is so important. And, we're starting a new year. So if you're thinking about starting a family, or you just thought to yourself, well, I tried this year and I haven't been able to get pregnant. What's going on? Come see us, come check us out. Like Dr. Felix said, we'll go through the whole history with you, find out what you have been doing, what you haven't been doing. And sometimes, like Dr. Felix, sometimes it's not that complicated, right? Sometimes there's like an easy or a quick change that can help you get pregnant.
Yep. Sometimes it's so simple. Sometimes you just need a little progesterone support. Sometimes we just need to get you onto a timed cycle. Sometimes it's easier than you would imagine.
Yeah. And even if you're not ready to get pregnant, but you're curious about what your ovarian reserve is right now, like that, like Lara said, like she had no idea where she stood when she finally went. If you want to just have an idea, maybe you're not planning on having a family until another year or two, but you just want to see where you're at. Like that's fine too. We can consult with you and help you. That's what it's all about: family planning and what you what you want to do with your body and when you want to plan, or if you don't want to plan to have a family, so you can have those answers.
Right.
Thank you so much, Teresa, for this great overview of the infertility, what it is, what kind of options, treatments are out there. I hope our listeners have learned a lot about this service and what infertility is and involves, and where to find solutions, especially for this issue. Because at Planned Parenthood, well, we understand the emotional toll that infertility can take, and we are happy and here to help in provide comprehensive care and support to anyone that needs it, right? Let's also remember that our infertility services include initial evaluations, hormone testing, and also referrals, like the doctor was mentioning, to specialized care when it's necessary.
This service is also available via telehealth.
Thank you, Michelle. Thank you, Dr. Felix. And well, take care and see you very soon.